Hey guys, my name is Jackson and welcome to the Guide to Mental Health and Wellbeing brought to you by YakTV. We're going to discuss how to look out for signs and symptoms of mental health issues, not only for yourself, but also for friends and family, and how to manage these when they come about. This video is only intended as a guide and should not replace professional medical advice, so please refer to the links below in the description box for resources and contacts. But hopefully you guys find this video helpful. Now, there are two conditions that I would like to talk about, those being depression and anxiety. Depression is a mental illness which can affect anyone and is common amongst young people. Now, most of us may feel sad or moody or run down from time to time. However, some people experience these emotions for an extended period of time without any apparent reason. This may be diagnosed as depression. The exact cause of depression is not yet known, but some triggers, such as traumatic life experiences or personal factors, can indeed play a part. Depression is a mental illness which affects the way people feel about themselves, and so signs and symptoms can include a loss of interest in work, hobbies, or the simple things that person may usually enjoy. It may also include a lack of energy and sleep deprivation, which results in those affected being more irritable and simply finding it hard to concentrate. Put simply, depression makes day-to-day living a lot harder. The second mental illness I would like to touch on is anxiety. Now, anxiety can be best described as a persistent feeling of being nervous or stressed. These feelings are common to us all, however, to some people they do not subside, making day-to-day life a lot harder. Similarly to depression, the cause of anxiety may be attributed to a series of factors such as ongoing stressful events like having a huge workload, taking care of the kids, or simply pressure to do well in sport or at school. Physical health problems and substance abuse may also result in anxiety. The symptoms of anxiety are slightly different to those of depression, where with anxiety you may feel tightness in the chest, a racing heart, hot and cold flushes, and just a snowballing of worries which won't go away. So whilst this list of symptoms does not provide a diagnosis for depression or anxiety, it does provide a rough guideline which may indicate the need to see a medical professional for a correct diagnosis. Our brain and our mental health is like our physical health. It must be maintained and cared for. There are several ways that our mental health can be supported, with exercise being a major one, as it releases endorphins which create a positive feeling in our body and in our brain. Now, whilst we can try and maintain a positive and healthy lifestyle, there are some events that are out of our immediate control, such as the passing of a loved one. So it is important to look at ways in which we can recover and heal from such unfortunate events. So Hib is now going to chat to you guys about the ways in which these symptoms can be managed.
So, what do you do if someone with mental illness comes to you for help? Well, one of the most important things you can do is just sit and talk. A lot of people feel relaxed and a little bit better if they know there's someone to talk to and someone on their side. Once you've established a line of trust between yourself and the other person, just try and get some background information, such as do they have a good support network of family and friends? What's really bothering them? And have they tried therapy? You can also suggest for them to talk to their GP about a mental health care treatment program. This can help them get professional help under Medicare rebate, which is really great news for people who think they can't afford professional help. As a good friend of theirs, you should hang out with them and do things that they like, or suggest long walks somewhere nice. But don't put too much pressure on yourself to solve all their problems. In the end of the day, you're only human. It's better to refer them to a professional counselor who can help them in the right way.
What are some of the main mental health issues students suffer from?
So here on campus, I guess we're like any other university campus, and the main ones for students here are the same ones that are in the community as well for those not studying. So mainly depression, and depression in the young population of 18 to 24-year-olds is usually around about 20%. And then anxiety is close behind that on 10. And then the other big one here on campus with university students is usually substance use disorders. And sometimes it's around that interaction between depression and anxiety and the substance, and it's become a coping mechanism for students in that way. And also a bit of the lifestyle here on campus as well, as people come to university and they kind of think, oh, we'll have a drink, one or two, and they might be away from family be. And here on university, they're a bit more responsible in terms of nobody's checking if they're doing their assignments, it's all up to them.
What are some strategies students can use when they're feeling stressed and experiencing any sort of mental health issue?
I guess in general terms with looking after your mental health, it's a good idea to get the basics right. So making sure that you're eating those regular 3 meals a day. It's really easy for a student just to skip a meal, to not prioritise what they're eating as well. So focusing more on the quick snacks that you can get rather than making sure you're getting the healthy balanced diet of the vegetable fruit intake and following that lovely pyramid that someone set up years ago. And so it's really important to get the eating right and then mixing that also with good sleep patterns. And what university student do you know actually has a good sleep pattern? They're usually staying up all night doing assignments, and then if they can, they'll grab a nap the next day in that way. So it's a good idea to set up a routine, I guess, about when you're going to bed. And that's not to say you have to do it every day, but it's a good idea to get into a practice of making sure you're not up till 1 and 2 o'clock every night doing assignments and then missing out.
What are the signs and symptoms that can let someone know when they need to seek support?
And so I guess for every person it's different, but the main ones really are around when you're noticing changes within yourself. So when it is that you used to be someone who made it to the gym 2 or 3 times a week and now you've got no time to go to the gym. And so that's something that used to be important to you and now all of a sudden it's dropped off. Or when your friends are ringing up and they're asking you to do things and you're constantly saying no to them because you feel you've got to prioritise one thing over another. For other people, it's around that feeling of being overwhelmed and not really knowing where to start. And so procrastination, when you start procrastinating more and avoiding more and more activities, that's the time to put your hand up and say, hey, I need some help. And sometimes it can be related to something a lot deeper, like maybe something going on in your personal life. Other times it can be completely around just that preparation for an exam or getting an assessment result.
Okay, and where can students find support?
So if they're here on campus, there's a few things that you can do to get support, and students want to have support in different ways. So one of the ways we offer support here on campus is we have health and welfare advisors, and you can get a 20-minute appointment with them. All you need to do is ring up on the day to the counselling service and try and get an appointment, chat over your options, and from there they can give you the links to all the resources that are available. And so people often think, oh, a health and wellbeing advisor and counselling, like that's not for me, but the health and wellbeing advisors actually refer to a lot of different places. Some are referring to study skills, some are referring to relaxation groups, community resources as well that are out there. Others, it could be financial pressures that are getting in the way for students, and so alleviating them through vouchers or student hardship loans available as well. So they really try to look holistic at what areas we can help in. And part of the online tools here is also there's a Skype drop-in hour 4 times a week where students don't need an appointment, they don't need to say who they are either, they can just ask general questions around wellness or what's going on campus, or I need help with something in particular, and we can sort of triage them or help them find where it is that they need help.
That's great. Well, Kellie, thank you for speaking to YakTV and thank you for the advice.
Thanks for having me.
Show a little grace. When someone's going through a hard time, small issues can be blown way out of proportion. These crises can trigger various episodes, so be sensitive. Be prepared to listen at the right time. Sometimes the person may want to talk, and sometimes they won't want to. People need to share their worries in their own time. So listen without being indifferent or trying to fix the situation. Beware of dismissive comments. It's easy to make statements like, I know someone who had the same thing that you had, but no 2 losses are exactly the same. Instead, look for opportunities to gently encourage. These can be meaningful and helpful, especially if you avoid phrases like, I don't know how I would have handled that.
That's a lot of good information to take in on such a short amount of time, so let's just relax for a minute because that's the best thing you can do when things start to become a little bit too much. Any type of person can have a debilitating mental health condition. It can really affect your way of learning, your confidence in learning, and can also affect your concentration and ability to think correctly. If you feel like you've been watching this video and you feel like you need immediate assistance, do call Beyond Blue at 1300 224636 or visit their website beyondblue.org.au. The University of Newcastle has a huge array of online sources. If you want to do some research, just go to newcastle.edu.au and search mental health services in the search bar. There is a huge variety of online resources available to you as well, and we have linked the best ones just below this video for you to check out if you're interested. However, there is free confidential counselling available at Newcastle campuses, Central Coast campuses and Port Macquarie campuses.
Well, there you have it, guys. Some info, tips and hints about taking care of your mental health.
And for also keeping an eye out on your friends and family.
Because we all know things will go a lot smoother if we just reach out to each other.
So from everyone here at YakTV, take care of yourself and those you love. Thanks for watching.